Today we're going to talk about the mental health of missionaries. This can be a super sensitive topic for a lot of people, me included. I know how much my mental health was minimized or diminished by leadership, by other missionaries, and so I know the things that people shared with me can be really sensitive. And so first of all, thank you for sharing everything you have, and also you're not alone. I think this is only going to show that so many of us experienced some really difficult things as missionaries, and it affected us probably for years to come, maybe still does. I hope that you get a little bit of closure sharing these things and, hearing your experience recognized, even if it's anonymous. Also, we may talk about some topics that can be triggering for some people, so just warning here. One story mentions sexual assault of a child. We'll talk about some, different mental illnesses and different experiences. So if any of that is triggering for anyone, maybe this is not the video to watch, but I just wanted to make sure that everyone felt recognized and seen for the things that they went through. The amount of messages that I got about people having panic attacks for the first time as missionaries was unbelievable. That was probably the most common response that I got, or that they developed OCD. OCD for religious situations is extremely common. I think it's a form of religious scrupulosity where you want to be obedient so badly that you do it to the point of, developing OCD around those things, making sure that you were waking up exactly on time, you were doing everything exactly to the minute when you're supposed to be doing it. Like I mentioned in my last video, there were some situations where people would take expectations to the extreme and do things that were absolutely not required of them, like fasting for multiple days at a time to get more baptisms, or for completely sacrificing your P-Day, or for choosing not to speak to your family as if that will bring you more blessings. Yeah, that for sure can mess you up. So that was really, really common. And of course, limiting yourself to such an extreme level, you're gonna develop some anxiety, you're gonna develop some OCD. I mean, a lot of those things can just slowly happen as you're put in such a restrictive, extreme environment. I have had a lot of people say, well, that's your experience, that's not mine. So I think this is really important to acknowledge all of these different situations, because sure, maybe one person did not have severe mental health struggles on their mission. So happy for you, really. But a lot of us did. And that should not be looked over, that shouldn't be looked past, and that shouldn't be seen as a small portion of missionaries. I honestly think that the majority of missionaries who serve experienced some form of a mental illness, whether they recognized it or not. The first one that I wanted to talk about, this sister lived in some really dangerous situations, and she was stalked by the unhoused population in the area she was in. She lived next door to drug dealers, and she unfortunately witnessed someone molesting a child in a park. Awful. I mean, there are no words to describe how that must have felt for her, that poor child. That's, obviously wrong in so many ways. What makes it worse, though, is that her companion did not allow her to call 911. And unfortunately, I think that is a common expectation of missionaries, to just look past things, because the church, I wouldn't say they tell you not to call 911, but they kind of do, like they tell you that they don't want you involved in any sort of law enforcement activity. If you witness something, you're sort of just supposed to leave it alone and move on. And I feel like abuse in any form should be the one thing that you do talk about. Witnessing a car accident is one thing, but seeing a child being sexually assaulted, there's no question that should be reported immediately. So really awful, and I'm sure that has happened more than once. I know of another story where someone was living in an apartment where next door a child was frequently being abused by the guardian or whoever was living there, the adult. And yeah, they couldn't report it, or they were told they weren't supposed to. And as a missionary, that may sound crazy to some people that they didn't report it, or that they didn't just, not listen to the rules. But with the level of pressure and expectation they have of you to listen and follow the rules, it's like your own moral authority goes out the window. That's hard to explain, like I've mentioned in other videos. It sounds wild to other people outside of the church, or those who haven't ever been in a really extreme religious situation, but it's really, really difficult to see how your own feelings and your own moral compass, your values, can be different than the religion that has raised you, or the one that you are currently preaching about. I heard a lot of stories that were really similar to my own, in terms of being sent home because a mission president was not prepared to or did not want to help a missionary to get the help that they needed, to have the support they needed. I wanted nothing more than to finish my mission. Whether or not that was, the right thing for me, obviously I went home, so that was how that ended. But I think in a lot of cases, missionaries could be absolutely successful if they were just given the tools to do so. And sometimes that's being medicated. Sometimes that's finding a therapist who's actually going to help them with their personal issues, not missionary issues. Like, if someone's struggling mentally, it really probably doesn't have anything to do with being a missionary, but the missionary work is just exacerbating it, and they're not allowed to address that. The sisters were breaking my heart in my DMs. The amount of them that told me that they were called flirts, and that reputation followed them around for their home missions. And of course that's going to mess you up if you know that you're just friendly. Like, contrary to popular belief, women do not just want to seduce men. The sister missionaries are, in my experience, and I think they are even more dedicated than the elders to what they're preaching, because it is entirely voluntary for them. The church has an expectation of young men to go on a mission. They don't of sisters. Sure, it's like, yes, we would love for more sisters to serve. I'm sure, they say that, but it's not a requirement. And so they are choosing to dedicate that amount of time to serve the Lord. And most of them are not going to throw that away for some silly little elder. So yeah, that's awful. And I think that just is part of the patriarchal nature of the church. Okay, so there's one here that I actually wanted to read because it is insane. This person that DM'd me works at a crisis center in Utah, and it's basically an emergency room for mental health, right? And she has seen both male and female missionaries getting sent home early. Their families bring them straight to her work from the airport, and they consistently present with being paranoid, experiencing psychosis. Some are having a faith crisis. And she says, I believe a lot of it comes from sending young kids away from their families for so long, and a lot of them being in a completely different place. It's a lot of stress on their mind and body to live up to what's expected of them while still being a teenager. She has seen 2 different patients who were assaulted on their mission, who came home for being suicidal due to the mission leaders not believing them and not being able to receive proper care after that. She says another thing that can cause the psychosis would be the extreme stressors, any sort of abuse and your body being in fight or flight mode for long periods of time, sleep deprivation, or even just a lack of sleep mixed with poor nutrition. I think this touches on a lot of things all at once. But yeah, that doesn't surprise me at all, unfortunately, that missionaries come home with, showing signs of psychosis when you're in this level of such extreme expectations and requirements and limitations. The abuse thing. I mean, I could say a lot of things about that, but not being believed. Obviously, the world has a problem with that. But yeah, the patriarchal nature of the church, women are not recognized, listened to, valued like they should be. And that, of course, translates over to missionaries and sisters. There were quite a few responses that talked about not being able to receive medication as missionaries for depression, anxiety, any other mental illness. And I really think that this would have had a major impact on my mission experience if I were just given the proper psychological support that I needed. If I had been given medication for my anxiety and depression, I think things would have been so different. But all I was offered was therapy. And yes, therapy is great. It's a great resource, and it should be used in conjunction with the other support to help someone with their mental illness or just with the really extreme situations they're in. And a lot of people were prescribed certain medications, but then unable to receive them because in some situations they were controlled substances, like Xanax, and the mission president would not allow them to get that. This person who messaged me about that said that it was against mission rules or something like that. And I had never heard of that, but I mean, I don't doubt it, that there's a certain limitation on the medications you can take as a missionary are the ones that they will allow you to take and still be out in the field. Another one I want to read has to do with a death in the family. She says, about 6 months in to her mission, my aunt was killed in a car crash. I was very close to her and I was distraught. I cried every day and didn't feel like teaching or doing anything really, obviously. Just going through the motions trying to figure out my feelings. 1 week after I got the news, my older and wiser companion asked the STL to have a swap day. I found on their phone a text between my companion and the sister training leader telling her how annoying and too sad I am. After all, it was just an aunt, not a sister. I also had to talk to my president because she complained to him too that I wasn't doing the work. Well, home life sucked, so I put on a happy face and pretended to be fine for the rest of the year I had left. I still struggle with depression and feeling like I'm not good enough or happy enough. That is heartbreaking. I'm so sorry you experienced a death at all, but especially as a missionary, not being able to be there with your family and receive that, support that you needed. There's almost an expectation in missions that, when a death happens, you shouldn't be sad about it because we have the knowledge of the plan of salvation and we know that we will one day be reunited with our families if we live the gospel. I'm sorry, but we don't know, how long it'll be until we see that person. It's perfectly okay to be sad. And it's also perfectly okay to deal with that in whatever way you need to. I have an aunt that I'm very close to as well, so I would be devastated if she died. And I can only imagine how hard that was to be minimized in that way and to just be seen as lazy and dramatic, and that's just terrible. I also think there's an expectation with missions where if someone does die in your family, you're not supposed to go home. I knew someone whose father passed away while she was a missionary, and she did come home and went to the funeral and everything and then went back out. And it's almost like there's this celebration when a missionary is so strong that they're willing to finish out their mission even though a parent died or a sibling died or something like that. And even though, maybe that was the right choice for her, and I'm happy that she was okay with that and that was what she felt was best for her. But we gotta stop expecting that sort of level of faith to be seen as the expectation or the kind of thing that should be celebrated. If someone comes home, let's celebrate them just the same because they just had a death. Like, there's no right or wrong way to deal with that. And no matter what that person decides, however they deal with it, that's their business. And we should just keep our mouths closed. One more wild one for you. Somebody was not allowed to go get new glasses as a missionary. So they were in Sacramento, California, not even a different country. They were here in the US. And they would have to leave their area to go get new glasses, to go get a new prescription, to go get a new pair, right? And they were not allowed. And this missionary spent multiple months without vision. That is wild. And they were supposed to drive. They were expected to still, live as normal, but you can't see. Thanks for coming along with me for the ridiculousness that is some of these stories. I am so sorry that any of this had to happen to any of you and any of us. I think those of us who come off of a mission and have the trauma and the painful memories, it can be hard to remember the good ones. And a lot of things are just tinted, instead of rose-colored glasses, it's like this grief that clouds everything. And so if you're in that boat, I'm with you. We got to stick together. You're not alone, and mission culture needs to change.